Welcome our dear viewers to the Dr. BMS channel. This is a channel which informs you on all matters mental health and mental well-being. Today we have another exciting session. We have a discussion with one of our guests. I have a surprise guest. She's going to introduce herself and tell us more about her work, and you're going to like this. Welcome to Dr. BMS. We are happy to have you, and introduce yourself to our viewers.
Absolutely, yes. Hi, thanks for having me. Dr. Julia Lopez here. I work in St. Louis, Missouri, in the U.S. I'm a licensed clinical social worker. I've practiced for 15 years. I primarily practice with Spanish-speaking immigrants and also um, other immigrants and refugees in the U.S., but I am a Venezuelan immigrant, and so primarily Spanish-speaking immigrants is who I work with, as well as LGBTQ folks in the U.S. I also have my PhD in public health, so a lot of my research and work in public health is in relation to community sources and engagement as it relates to mental health and substance use. And so a lot of the focus is in trauma and trauma-informed care practice and using different kinds of modality and research to kind of figure out ways to kind of engage in a way that is clinically relevant, but also focusing people in a way that is really putting people first and making sure that we voice their platform and opinions first and foremost.
Wow, what an introduction, what a bio. You can see the type of guests we have in our channel. Diversity.
Diversity. That's right.
Yeah, so our channel is mostly on mental health, so you're in the right place. And we like to hear, you say you're from Washington University in St. Louis.
Yes.
Are there any cases of mental health problems in Washington?
Of course, yes. I think mental health issues are all over the place. I've lived in St. Louis for 16 years.
16 years?
Yes. And I went to school in St. Louis for all of those years, and since I've been there, I've worked in case management. I've worked in the hospital. I've worked in housing for people who have had mental illness and substance use and co-occurring disorders. And so in all of those years, a lot of the time it's for people who have either had no income, had limited income, no insurance, those kinds of things. And that is a lot of times the issues that we see is that people who don't have access to health care, who then also have mental health issues, who don't have support systems, and then really trying to be able to have a level of support that we can be able to provide, but also knowing that people come from their own strengths and capacities, and that we need to highlight their strengths and capacities in their own ways, and that we shouldn't shadow that either. So being really cognizant and aware of that is also really critical in the work that I do. Really trying to be really true to that. There's a lot of great organizations in St. Louis who do a lot of different kinds of support and work, and sometimes some of their work is cross-sectional, so they'll do work that is very specific to certain groups of people, depending, so refugees or for specific immigrants or for specific maybe children or adolescents or older adults. It just kind of depends. And sometimes we'll do kind of spaces where we'll come together and we'll do lifespan kind of work as well, so it just kind of depends on what is necessary. But there's definitely a huge need, like there is in all around the globe.
Yeah, mental health is a global health problem.
Most definitely.
Yeah, so thank you. So in your practice, what kind of problems do you find yourself dealing with on a day-to-day basis?
Yeah, so I work primarily, I have a private practice, and I would say primarily in my private practice it's a lot of trauma, so post-traumatic stress disorder. But then in the clinic, I work in the HIV clinic, and I would say a lot of it still is trauma and depression and anxiety, so a lot of mood stuff and then trauma. So I think primarily my focus is always in trauma-focused work. So I use a lot of modalities that are very specific to processing trauma. So there are specific modalities that one can use to process very complex trauma. So things like eye movement desensitizing reprocessing, shortened for EMDR. Others that are cognitive processing therapy, so CPT. There's trauma focused cognitive behavioral therapy, so TFCBT. Um, there are things that are more body focused, so somatic in nature, that we can use to kind of process trauma, because we know that trauma is held within the body and then it manifests in the body a lot of ways through then biological ways. So I think a lot of things I work in also takes into account how we also see a lot of like biological and physical manifestations of trauma.
That's very interesting. I'd like to follow up on that because a lot of our viewers may be suffering from trauma and they are not aware. What are some of the things people should watch out for as symptoms and signs of trauma?
Yeah, I think for people, sometimes people don't know what may feel like, and so I think oftentimes if you're feeling stressed or if you don't know what has been overwhelming, I think things like if you're feeling like any one thing really heightens you up and you're not sure like what to do with that, or if you notice that your mind kind of goes racing, you don't know what to do with all of that, and you kind of go blank, or you notice that all of a sudden when you're thinking about something and then you find yourself just kind of lost, right? And you lose time, and then you kind of come back and you just kind of just all of a sudden realize you don't know where you're at, or kind of lost a chunk of time. That may be some type of response that you are having, and that's normal because that's our body trying to protect us, and that's totally okay. It's just that perhaps it would be an opportunity for you to be able to get some additional help, from like a clinical psychologist, or another therapist, or someone, that be able to help process some of what is happening. We sometimes get really anxious, so, racing heartbeats, sweaty palms, like not being able to really think. Our brains kind of get into like a really cyclical pattern where we can't really process the things that are coming into our minds. So that is also really common, and so that happens sometimes when we've had lots of different kinds of like traumas, and like we haven't had the opportunity to kind of think about all the different things that have happened to us. So I think there are many things, and I think everyone kind of experiences them in different kinds of ways. But those, I would say, are kind of some of the more common things that people will say. But I would say that it never hurts if you find yourself having difficulties at any point in time to, talk to someone, and that, you can always have more opportunity to discuss further.
Thank you. So actually the message to our viewers is there is help, and one of the main things is seek help. Come out when you're experiencing some difficult situations or some emotions you are not able to process. Seek help, and they are professionals, and you can see they are at different levels.
Right.
Wow, that is very, very, very important. We appreciate that information. So what else can you tell us about your work?
Well, that's I think for me the most important piece of the work that I do, I think, is that most importantly is that people feel like they have a space for which they feel comfortable being able to express what it is that they need. And that's really hard to find when either you don't feel safe in being able to do that, or that you haven't had the space to do that, or you haven't had the opportunity because of life reasons. So I think the reasons for my like work, and the things that I do in my research and in my practice is really trying to bring those spaces together in a very concrete way.
That's very nice. We appreciate your time. We appreciate all the information you passed to us.
Oh, well,
you realize a lot of what we're discussing, most of the people are going to watch in Africa.
Yeah.
We are in Uganda, our viewers. We are in Masaka, Uganda. And we are here following up on the issues to do with mental health. And you can see it's a global collaboration.
It is.
Yeah, so...
And we met on the trip.
Yes,
and it's been great.
It's been nice. So We appreciate you watching the Dr. BMS channel. If you've not subscribed, please subscribe. Follow us, like the videos so that we can bring you more informative videos. We are going to have more discussion on trauma and trauma management, bringing you specialists to tell us more on what you can do if you have faced traumatic events. And feel free to come here and get all the kind of help you may need. Ask questions. Tell us in the comment section what you'd like us to discuss, what you'd like to hear more, and as usual, we'll bring it to you. Thank you very much, our viewers, for watching us, and keep coming. Thank you.